guess to start with, if I can, I'll just jump right into this. Our legislature
Yeah, please.
yesterday, both the Senate and our House of Representatives agreed on a bill that is going to force public schools to every public school, every LEA to offer some form of in-person learning. Send it to the governor. And so the governor's got 10 days to decide if he wants to accept it or veto. And it passed with a supermajority. So if he does decide to veto it, then they could override his veto. I think one of the biggest concerns that the governor has is that there's some loss of local control, but I really don't know what else his reasons are, but I think that's one of the big issues that he's mentioned as these negotiations were going forward. I live in Raleigh, which has the largest public school system in North Carolina, which just this week opened up for in-person learning. And so I put a link to the return to campus guidelines for families, and I think it's worth reading. It's pretty detailed, but also I think leaves a lot of gaps, but that I think they've been working on it for a long time, and I think they were using a lot of things that maybe might not be appropriate, but it's out there, and hopefully, I think it's worth taking a read. So when I originally
put that in the chat.
When I originally started preparing for this, it was a couple weeks ago, and it was right around the time that the president and the CDC were talking about, it's safe to reopen schools. And these were several of the studies that were cited as it is safe to open schools. And first one, obviously, the first cry was the first about the schools in Wood County, Wisconsin, was obviously, rural schools are different than urban schools. So, but all these studies have some limitations in them. The second one was a publication in Pediatrics, which actually came from a group called the ABC Science Collaborative, which is between Duke University and University of North Carolina at Chapel Hill. And it was actually done last fall. And it's a pretty interesting study. And they came up with their 12 principles for safer schools. But they really, their goal there was to help communicate what they call the science and leave each individual school system up to deciding what policies they think might work best. And then the third study was hasn't been published fully, but it was really in 2 independent schools, which I think are private schools. And basically they had stakeholder engagement, what they did for the physical structure, policies and operations, and screening and testing. And so they were really looking at, when the cases occurred. And the biggest thing they found was that the cases seemed to spike after prolonged school breaks and after they knew that students attended social or family events in the community. Sports were a big issue. They said temperature screening wasn't useful, and also since they were private schools, they had a lot more resources than other school systems might have, so that's a really big challenge. There was a couple of other things that came out too. First, there was the editorial in the Journal of American Medical Association about data and policy guide, and then the executive orders that came from the president. And when I was listening to the Healthy Schools Summit from the Coalition for Healthy Schools, one of the things that they passed on was this petition from a group called National Nurses United to get the CDC to change position and recognize that COVID really is transmitted by infectious aerosols. And of course, last week, Friday, the CDC put out their guidance for operational strategy for phase mitigation. And then just for fun, after the president put down his executive order about face masks, they actually had to publish exactly what that meant in the Federal Register. And here's the note for the Federal Register, which I think is pretty interesting because it goes into a lot of detail about what masks are and implementation and all that other stuff. So I think that was pretty interesting. I think there's still a huge problem with terminology in this mess. It's really confusing. So this is one example where somebody was trying to, get a consistent way to classify droplets, aerosols, particulate matter, droplet nuclei. This was from this particular author. But I think the point is across the board, depending on your discipline or your viewpoint, all these terms have different meanings. And I still think there's some confusion about that's out there. And again, it makes it challenging because um, the particle size, it's a moving target. As we have heard that the part, it might start out as a droplet, but it might end up as a aerosol or even a droplet nuclei as it moves through the air. So that's really a huge challenge.
Yeah, David, if I can, if you can go back to that real quick, just I think when we were discussing this a week or two back, I just thought this was really helpful just to think about when you're doing communiques out to your stakeholders about what this is. Having some way to bring it down to earth on what an aerosol is. Having an image of hairspray product or something that diffuses off into the air. I was thinking in icons on the general public as ways that might help communicate, these technical differences between an aerosol and a droplet. That pictures really help, and I appreciate you bringing this. And for those of you who are just joining us, let me just real briefly, for if you're joining us after the fact, we're speaking with David Lipton, who's an industrial hygienist with the state of North Carolina, Department of Health and Human Services. And David's been a real consistent contributor, participant in these conversations. And this is the second time presenting on our series. And he's going through a little bit of some of the broad history here and some of the recent research that's been used to cite reopening guidance from the federal level, and then it's going to get into sort of cleaning, disinfecting, and sort of what his view is moving forward on that. As always, please put your comments or questions in the chat box and we'll field them. I'm sorry, David, go ahead.
It's fine. And this probably is not relevant to this audience, but when I think of the term droplet nuclei and their description, cloud condensation nuclei, now they're talking about water, but what I think of is the technical definition of a fume, which actually is, it comes from, which is actually tiny droplets or solids that form as a condensation product. Like if in lead, if you heat lead up to its boiling point, the lead is a vapor, and then once it gets away from the heat source, it quickly condenses into these fumes. And so to me, that's, could be a cloud droplet. But anyway, there's a lot of, depending on your discipline or whatever, there's still confusion about what these terms actually mean. So this is another example, where people were trying to figure out a consistent way to get the word out about what these different particles or droplets might be. And this is from the, this author. They were thinking more of a process focused definition as opposed to particle size focused definition, which I think there's some merit to it, and that's kind of actually pretty consistent with what Dr. Bazant was talking about. That I think that might be a way to kind of get people. I think that's a really interesting alternative to get away from these. To get people consistent on the same page about what the definitions of these different types of.
And David, one of the things that Professor Bazant said in the last couple of weeks was in his read of the data that fomite or surface-based transmission, he has not seen evidence of that being a vector for spreading this disease.
Yeah, and I'll get to my personal opinions on that as we go forward. So Here's the
Perfect. Okay.
challenge that we all face, and quite frankly, if you're a school administrator, it's an incredible challenge and dilemma. There's no doubt we got to open school. I don't, and we got to do it in a way that, and and actually, I made a mistake. I should say in a way that minimizes the hazard to staff and students. Because, and that was a mistake on my part. Even I do that. But over, I try to differentiate between a hazard and a risk. They're not the same. A hazard is a condition that might cause harm, and a risk is some sort of estimate of the probability and severity that the hazard will cause harm. And they really are different. And in risk assessment and risk communication and risk management, really it becomes important to understand that. So now the question becomes, which of the risk mitigation strategies that are out there do you want to emphasize? Depending on your school environments and different cultural and behavioral norms, and also really importantly, keeping focused on the mission of public education. So, which one do you want? And I think everybody will say that at this point that mask wearing is probably worth focusing on. Good hand hygiene is worth focusing on, um, and maybe increased disinfection maybe shouldn't necessarily be. Cleaning certainly should be, and maybe improving ventilation. I think there's lots of good reasons to improve ventilation in school buildings and other places, but I'm not so sure if in the short term that would be the place I would put my emphasis. So you've got, which do you pick, and then which are you going to actually implement? And you've got all these people that are, you've got physical constraints, you've got logistical issues, you've got uncertainty in the science, you don't want to have unintended consequences, you've got myths, biases, misinformation, and you've got all these people telling you what you think you need to do. And how do you sort that out? It becomes a nightmarish challenge, and I don't claim to have any good answers. But what I will say is that there is some ways to think about risk communication, and I can provide some other references. But everybody, different publics and different individuals do view risks differently, and so understanding your public is really crucial. There's a guy named Peter Sandman who used to be at Rutgers, who has been publishing on risk communication, and he says that that risk is really the hazard multiplied by the outrage. And by outrage, he means all those other things, the myths, biases, misinformation, all that other stuff. And so, for example, people are willing to accept risks that are normal, but they might not accept a risk that's abnormal. Or they might accept a risk at which they feel they have some control over versus something where they have no control over. Or they might be less acceptance of a risk like cancer, which is dreaded, versus some other disease which might be cured or something. So there is a whole body of knowledge on this risk communication. And if you're doing this stuff, the important part is that you need to build trust in your audiences. You need to understand the limits of knowledge, and then it's perfectly fine to understand and acknowledge that the science isn't perfect, and that um, to a little bit of humility is helpful. The graph on the other side, or the picture on the other side, there's all sorts of information coming back and forth, and they all play into each other, and there's a lot of misinformation out there, and that brings up to the last topic, which I kind of have called, for lack of better terms, I call it the COVID industrial complex. And so you've got this incredible array of people and institutions and organizations. They're selling you goods, they want to sell you services, and then even at a third level, there's an intense competition in marketing between institutions, organizations, individuals, and that even includes within different government agencies in the federal and state government. everybody wants to become the influencers or the thought leader. So your challenge or your dilemma is how to sort out what to do in this total cacophony of noise. And I don't at all, um, I don't envy you. And it's something that I deal with more on an individual basis, but I don't really deal with it on a group basis. But it is really a, it's a tremendous challenge. So I want to talk a little bit about fomites because this happens to be something that I might have stronger opinions than other people. But the fact of the matter is viruses, they eventually get inactivated. They cannot live outside of a cell. And in fact, some people, ecologists call them obligate parasites. And so with touch transmission, basically it's a pretty complicated pathway. Somebody's got to release the viral droplets or whatever you want to call it. It's got to land on a surface. Then the susceptible person has to touch that surface, get the stuff on their hands, and then they've got to transfer enough of that virus to cause an infection to their mouth or nose or eyes. And it's a really complicated pathway. And of course, if you can break any one of those, break anything in the chain, then you have stopped the spread of disease. So early on in the pandemic, there were studies that showed that the SARS-CoV-2 virus could remain on surfaces for a long time. And there's even this model that came from Department of Homeland Security that's hyperlinked there about that, where you can calculate based on the ambient temperature and relative humidity and UV light how long the SARS virus might survive on surfaces. But when you read the caveats or the fine print at the end, they tell you, well, we don't know how much of the infectious dose is there. We don't know how much virus a person sheds, and as we've seen in the past, it's variable depending on the course of their illness. We don't know how much virus comes off the surface, and so is touching a button or touch screen or gas pump, is that different from sliding your hand up and down a handrail, on a stairs? And then finally, assuming you get the virus on your hand, how much virus gets transferred from your hand to the susceptible surface? We don't really know. I think that most people would agree that an infectious droplet on a surface is a much greater hazard, especially after a sneeze or cough, and maybe not so much a few hours or days later. And so, in my mind, that points to the need for you not only thinking about routines for cleaning, but maybe thinking about exposure events or triggers or incidents. I'm not sure what the right language would be that would trigger immediate cleaning to get that stuff off the surface. And even if it's not perfect, you've still got the layer of hand washing and avoiding the surface until it can be inactivated. So to me, I would think about that. I'm not sure if people really think about that for cleaning. I think that there's still a lot of debate about the logistics of the who, what, when, where, and how cleaning and disinfecting surfaces and contents is actually going to be implemented. Um, Obviously, you don't want kids handling disinfectant products, but I think it's going to vary quite a bit. I think it's also important to know that there's a benefit for cleaning and disinfection as it comes to other pathogens. And so for norovirus or hepatitis A, those are both absolutely touch transmissions. In hepatitis A, it's hand to mouth, or for both norovirus. And so, I think as you're thinking about this, it might be worth thinking about other infectious diseases that might be present and how you can apply to those. And it also turns out that norovirus and hepatitis A are non-enveloped and kind of counterintuitively, they're harder to inactivate than the SARS virus. It sounds kind of counterintuitive, but there's also, believe it or not, there's an EPA list G and that's registered antimicrobial products effective against norovirus, and they're usually higher level disinfectants than the ones on the N list. So this is my opinion. I think there is a considerable misuse and overuse of disinfecting products. You know, we gotta disinfect. Well, I think, and they are regulated like that. I think disinfectants, they are really broad spectrum antimicrobial pesticides. And so I think they should be selected and used like any other pesticide, like an herbicide or an insecticide. And I think that that's part of good stewardship. You know, that you want to try non-chemical interventions first. So avoidance, changing the habitat, making it, denying for other pests and integrated pest management. It's, keep them out. Don't give them food and water and a place to hide. You could modify that for microbial contaminants too. And then when there's going to be a real benefit. So I'm absolutely, for healthcare, for food service, after using the bathroom, diapering in a child care, I absolutely think disinfecting is a huge benefit. But broad spectrum, massive amounts of disinfectants on less hazardous surfaces or less hazardous exposures, I'm not so sure. And I see two downsides, and I think there is a little bit of a body of research out there. I think that if you overuse disinfectants, you are altering the microbiome because these are broad spectrum products. They kill the good germs and the bad germs. And I also think that the combination of disinfectants and antimicrobial products, all that stuff puts extra strain on the organisms and maybe a driver in evolution of more resistant pathogens, which could be really bad news. Down the road if what So I think there's some downsides. I think a few people are looking at that. I don't have a link, but I will send it. There is a webinar. I think it comes from. There's a webinar next week about the toxicity of disinfectants, which I will certainly send to David. But I just, the combination of all these things, it just is so confusing, and trying to sort out the science and people's biases and all those other things. I quite frankly, I don't envy anybody that's got to do this for large audiences and for the public. I mean, it's interesting, but it is a major league challenge. I didn't have a huge amount to say, but that's basically my my idea. And I guess also what I would do if I was in charge with cleaning and disinfecting, I would actually be I would do something like maybe a time motion study where I would think about, who touches the surfaces, how often, when and where, the number of people that might touch it, the type of material, and all these things, So if I was gonna, as a stupid example, I might say, okay, you have a bunch of students coming to class first thing in the morning, and they all got to go up a stairwell. Well, the logical thing to do would be to clean the stairwell right after the crowd's gone through, or maybe clean it again right before lunch or after lunch or something. So you're trying to time it where you're going to get the most benefit. And I think, I don't know if people have really thought about it in that regard. And I guess at this point, I'll open it up to questions, comments. I don't really, I think I've covered most of what I have to say pretty quickly.
Sure, that's fine. I appreciate that. And, when you spoke with us I think it was last summer or late last summer, early fall, and you were getting into depth, and we'll send that that link to that presentation in our next communication here as well, on cleaning versus disinfecting, and sort of going into some more of the science of your take, that good cleaning is going to take care of a lot of our issues without a lot of the hazards of overuse of disinfecting. I think you called it, an analogy of Roundup. Roundup. It's going to kill everything. As you said, it's a heavy-handed approach, and it isn't cleaning. It's just killing things. And that good cleaning can remove enough of the contaminants in many cases to
On the other hand, I've got an invasion of English ivy from my neighbors, and no matter how good I am at pulling up the individual sprouts of ivy, I got to end up pulling out the Roundup selectively because I can't
sure.
control
And,
it.
and yeah, and I think that I really liked that analogy, David, as somebody who's not as fluid in this kind of research and work as you are, obviously. And as you were describing it, it just made sense. That sometimes you need to use that kind of approach, but that an over reliance on it has secondary, tertiary consequences that you don't want.
But of course, trying to tell people that you probably will run into a lot of pushback. So you got to think about the reality of people's perceptions versus what common sense or science might tell you.
Mm-hmm. And so, how do you think, given, one of the comments here was about priorities of ventilation, and you mentioned you had some thoughts on the comments in the past couple of weeks about the lack of data perhaps on fomite transmission of COVID and the dominance of aerosols. How would you kind of separate near-term and long-term thinking here? So near-term, where many districts are returning to school, sometimes because they want to, and sometimes because their hand is being forced. How would you advise in terms of prioritizing time and money and effort on surface cleaning and disinfecting and ventilation in the very short term, knowing that radical change is not possible, but with limited time and money, how would you help districts frame making clean surfaces and clean air from your vantage point and what you know? And then secondly, in those sort of the long term, looking at this time next year and the years forward, what do you think would be a good way to inform cleaning and disinfecting practices in our schools, given what you know and what we've learned?
I'll start with the ventilation part. I think, and Josh Chisholm way back last summer, he said it
Mm-hmm.
better than I could have. The first thing you got to do as your baseline is make sure that all of the components of your heating and air conditioning and ventilation systems, they're working like they're supposed to, and you've done your servicing and your maintenance and your repairs. I think
Right.
that's the baseline, and that's something that's reasonably achievable.
Mm-hmm.
Uh, some of my colleagues are getting ready to discuss, some of these issues for childcare, and the question of ventilation came up, and if it was a childcare or pretty much a smaller place, I would say, look, find yourself a really qualified and expert heating and air conditioning contractor. Get yourself a service contract and make sure that they're keeping it up. That's your baseline.
Mm-hmm.
Um, you know, and I think you develop a business relationship, and then if something does go wrong, you're at the top of the list. And I tell that to people all the time, who have complaints about indoor air quality in their homes. So that's that part. Down the road, I do think that schools are underventilated, and other buildings. Um, I think that it's going to be a challenge to improve ventilation in a lot of buildings. Um, and I think it's really going to need some thoughtful engineering so that if you do improve the ventilation systems, that you're keeping it in line with the intent of the original design of the building to the extent that you can.
Mm-hmm.
And I think that's going to be a huge problem when I talk to the engineers on our Department of Public Instruction, or an engineer who I talk to. That's his big issue is that, you know, the, it's a custom installation that was, between that takes into account the architecture, and it also takes into account what standards and codes and norms and state of the art and all the other things were at the time the place was built. And things have changed. So,
Mm-hmm. Okay. So
so I
changing.
don't have a good answer.
Mm-hmm. But
I think there
in
might be
terms of
some.
ventilation specifically, yeah, what you're saying is echoing what Joe Da Silva said at the beginning of this year in January, and what Josh said last August of first things first, make sure your system is working properly. Go outside and remove where people put plexiglass. And Jerry, you mentioned this. You showed pictures of plexiglass over air intakes. Like first, do your audit, do your site visual inspection, do your controls inspection, and make sure your systems are working as insofar as you can as they were originally intended. That's the baseline, and then your kind of challenge on top of that. And again, Jerry and Josh and Joe have echoed this as well. The changing the ventilation system for a building that was designed for that system, you have to have somebody who really knows what they're doing to throttle that appropriately and not cause other challenges or run your system too far in the red.
And then that brings up that if you solicit contracts from several different engineers, you'll probably get several different approaches too. So how do you figure out which one's going to work for you?
Yeah, it's going to be like everything in this past year, and an evolving consensus, and unfortunately not just dropping out of the sky for us, so to speak. One of the questions that came up here, and Jonathan mentioned HVA systems, that air cleaners can be useful in the classroom, and I would encourage you, if you haven't listened to the webinar with Jerry, who's on this call, and with Richard Shaughnessy, they talked about these things and some of the opportunities, challenges, and use cases for them. Debbie White, from also frequent part of our group here, asked a question about, she says, we clean buses with disinfectants and or electric sprayers between every bus run. What are your thoughts, given your feelings on overuse of disinfectants?
Well, I guess the good thing about a bus is that you can open the windows and you can ventilate it. I think it might be overkill, but then again, there's enough uncertainties that I couldn't be really strong about that. And then on the other hand, you've got people's perceptions, and if you didn't do that, you probably would get a lot of pushback. So, most of the surfaces in the buses are hard, non-porous, or plastic or vinyl or metal. So I would probably, even though I've got some pretty strong opinions about overuse of those products, I would probably continue that.
Need to turn the volume down? No, I'm good.
I would probably continue doing that more, because because of the uncertainties, and also because of the risk perception angle, that if you stop doing that, you'd get a lot of pushback.
Okay, that's a really interesting, and appreciate the nuance, David. So for the short term, if I can break it down, for the short term, in response to Debbie's question, all things being considered, perception as well as effect, and any remaining ambiguity about the data, keep on doing what you're doing, is what I heard you say. For the long term, so let's say we've moved past the moment. Should we be doing this 3 years from now, or should we be looking at a standard cleaning regimen? How can you help us think about the ratios of cleaning to disinfecting and when you apply those different strategies?
That's a really good question. When we had a debate about, how to deal with our state cars, and people were saying, well, they need to be, you know, disinfected between every use. And I'm saying, you take our state car that sat for a week in the summertime with the sun beating down on it, and it's been 120 or 140 in the car for a few days. I don't really think you need to apply a disinfectant. I do think you need to clean the surfaces down, um, but common sense would tell you not much is going to survive at the kind of temperatures that a car might get it in summertime. And then, of course, you would focus on the touch surfaces too. So I think maybe more targeted cleaning might be helpful. Um, I think again, understanding some about the pathogen is helpful too. I think that if you look at some of the guidance, what to do after somebody reports to your place of business or your school. I think one of the standard recommendations is seal off the room for a day, and that's because you're going to let nature take its course. So I would say try to use nature when you can. Um, I think cleaning has a lot of good benefits, um, and because you're getting stuff off of surfaces, whatever that stuff might be, and I think targeted disinfection probably is important too. Um, and I would say that not only for SARS-CoV-2, but for some of these other um, pathogens that can be transferred, which are really challenging to control. So
Mhm.
I would say more of a targeted approach would be what I would think.
So it sounds like, we have a 2x2 grid in a way, and perhaps I'm oversimplifying this, David, but we have cleaning and disinfecting on a targeted or a routine basis, kind of thinking about, I'm thinking about a matrix here. And is that getting to the point? And then if so, how do we, what do you mean when you say targeted? Are we talking in response to somebody being diagnosed with an illness, or in response to a sneeze, or are we thinking about creating a cleaning, disinfecting policy that we should disinfect XYZ services every 30 days, 60 days, 2 days, depending on the surface and depending on the use, and then immediately in certain targeted conditions? Like how do we frame that up again for the long haul about, I'm thinking that when we first started this conversation, the conversation was so focused on electrostatic sprayers for everything and fomite transition, and that was the concern. There were eye-popping numbers coming up in terms of expense of time and resources for cleaning. I'm just wondering about sustainability here in the long run, and helping us create a sustainable, effective cleaning and disinfecting routine. That's, what's the routine and what's the targeted instances when we need to respond immediately.
I think certainly having a way to um, target. I'm not sure what the right word would be if somebody sneezed on a surface, or you know, um, or when a surface was known to get contaminated. You know, cleaning and or disinfecting, depending, would probably be appropriate. Um, um, I think I don't see a value if you're not. I do believe in the tincture of time. So if you wait a few days, and particularly for SARS-CoV-2, I don't think disinfecting adds much value. I think the natural tincture of time will have inactivated any remaining viable viruses. Um, so I think the timeliness is crucial. Um, And then again, the idea of targeting touch surfaces, although you can't predict what people are going to touch, which is, a school bus, who knows what people are going to touch. That really becomes a gigantic challenge. You might be able to predict some things, like, hopefully, well, I don't even want to say that, but you might be able to make some predictions, um, that maybe floors are less riskier than seats or something like that.
Okay. One question that came up in the chat from Jonathan Jones was asking, will wiping down a wet or dry towel with a wet or dry towel provide some protection in lieu of using disinfectants? Can you help illuminate that question a bit?
I think microfiber rags are very good at picking up stuff. And I think other wet cloths, clearly it's not going to be as effective as soap or detergent solution, but there's going to be some effect without a doubt. I think preferably a soap or detergent solution would be better, but I think you'll get some effect no matter what you do. Maybe especially if you can catch it before while it's still a liquid. Um, I'm not really sure. I think there's going to be some effect. I think probably less effect than using soap and detergent, and then obviously less effect than using soap and detergent and then coming back with a disinfectant as a final application.
Okay.
That's another place where there's some uncertainties.
Sure. Okay. Can you help us identify the problem statement here about overuse and disinfectant? And you mentioned, the broad sweep in layman's terms about their kill-alls. It's Roundup. It takes care of good and bad bacteria and so forth. But how do we communicate the problem of that? Maybe another layer down. What's the real risk of overuse and disinfectants, and then obviously the underuse is understood, but is there a standard routine to disinfecting that should be followed, regardless of risk or perception of risk? If there is a known or suspected case, how should we be thinking about a good effective use of disinfection on a regular basis after thinking through the problem more deeply about its overuse?
Oh boy, that's a really tough. I think I've worked a fair amount with our environmental health specialists that work in childcare.
Mm-hmm.
And we actually, for our state, have really, really good and really tough rules for the sanitation of childcare. And some of them prescribe when you will clean and then disinfect surfaces in childcare, particularly surfaces where kids are diapered, food contact surfaces. So I think you got to be careful, because you don't want to be contrary to what they're being told by regulatory agencies.
Sure.
And actually, really, our child care sanitation rules are they're really quite complex, and the environmental health specialists that are out there enforcing them are really, really sharp.
Sure.
And I think the same thing might be said for food service, and certainly for healthcare settings.
Mm-hmm.
When you get outside of those areas, then I think things become a lot more complex. And I'm actually going to have to think about this one a little bit. I can try to think about it, and I can try to write you up some sort of a problem statement, but I'm going to have to ponder that for a little bit and think about that.
Well, I appreciate that. I appreciate just listening to your thought pattern as well, because I was taking notes, and then again, this is not has not been my world, and so just thinking about that, my question was too broad because the routine for what makes sense is depending upon the use case, and it's different in a kitchen, and it's different where you change diapers than it is where you sit on a couch, right? And then that made sense to me, that your effective use, it's not you don't apply the same standards to where you're preparing raw meats as you do where you're using a desk, for example.
Exactly. And I would have no problem with somebody, and as a matter of fact, that's probably a good practice. If you're preparing raw meat, you probably do want to scrub that cutting board down with soap and hot water. And then you probably want to disinfect it because, you have a legitimate hazard of transfer of salmonella or other pathogens from raw meat to other foods or cooking surfaces. And so you really do get a benefit from that.
Right. And that just for a layman, that helped me understand it. We had a couple of questions. Jonathan was doing a follow-up question and was asking if you could explain the difference between a soap and detergent versus disinfectant. And then Vonnie had a follow-up question about, is one of the risks that of overuse of disinfecting having to do with contaminant exposure to staff and students? So let you answer that in whatever order you think makes sense.
Well, I guess soaps are when I was a kid, I made soap. I made lye soap, and basically, to make soap, you take lye, and then you add oil, and you get a fatty acid that event, and the glycerin separates out. So it's soaps. They're really both surfactants, and detergents are synthetic versions. And basically, what they do is they help loosen up soils and stuff from surfaces.
Mm-hmm.
And I think some soaps and detergents do have, I don't think it's been quantified, but I think they do strip fats and oils from surfaces, or greases. And so they may have some antimicrobial effect, but it's probably minimal. And of course, then it gets confusing because then there's also products that are cleaners and disinfectants. So it gets really kind of blurred. But the point of a disinfectant, there are disinfectant products that have detergents or other stuff in them that help to lift soils up and help to get the product to the agent to inactivate it. But the point of the disinfectant is really to either chemically or physically inactivate the microorganism that you're concerned about.
So the soap or detergent lifts it off the surface. A disinfectant just deactivates it / kills it.
Because you're assuming that no cleaning process is 100% effective.
I see.
I think I think one of the things, and I need to do some more research about it, but when you look for people like in food service, they're looking at magnitudes of order of reduction of pathogens on surfaces. So if you can like a soap or detergent might be, they might reduce the contaminant level by maybe 10 or 100. And then when you apply a disinfectant, maybe you have it inactivated by 1,000 or 10,000. And I think that goes to why the products are labeled, kills 99.99% of germs. I have to do the math, but that's like a 3 or 4 log reduction from the original. And in critical places, you want a 6 log reduction. That's 1,000,000 of what the original level was.
Got it.
So I think I'll have to. I know I have some stuff that I've read about that, and I'll have to provide that. But I think that's kind of the reason and the way that disinfectant products are labeled. Kills 99% or 99.9 or 99.9% has to do with the log reduction from the original concentration.
Okay. And you disinfect because you assume cleaning isn't 100% effective. That's
correct.
That's a helpful frame. And then Vonnie was helping to explain further her comment, is the risk of the overuse of disinfection. She's wondering if the exposure of human exposure to the disinfectant, the chemicals in that disinfecting, is that one of your reasons for pause on the overuse of disinfectants? Is that one of your concerns?
Certainly, there are people that bleach, is a respiratory irritant, clearly. And I think that there's a body of evidence, particularly with quaternary ammonium compounds, that some of those with prolonged use are asthma triggers or respiratory irritants. And some of the other ones are much less. But even if you're overusing hand sanitizer, a lot of them now they have glycerin or some other emollient in there. But if you're overusing alcohol, you can end up with dry skin because it's taking the oils and stuff off your skin. So but especially, chlorine is certainly irritating. And I think there is a body of evidence about clots that with prolonged and excessive use, they are asthma triggers or respiratory irritants. And some of the other ones, not so much. I think the hydrogen peroxide doesn't last very long, and I think it quickly reacts with water vapor and air. Some of the other ones I'm not so sure about.
Okay. Well, thank you. Other comments, questions for David, either about sort of IAQ, indoor air quality, and how we kind of began some of the conversation about cleaning and disinfecting. Feel free to unmute and ask, or just pop it in the chat again.
I guess maybe I'll end on this.
Okay.
It was probably, I think it was around 2009. There's a group that's called the National Center for Healthy Housing.
Okay.
And they were starting a training program, and had this 3-day course on the essentials of healthy homes. And their guidance at that time was, what you want as a place that's it is dry and clean and well ventilated and properly maintained and pest free and contaminant free and safe, and that they all work together. And that was one of that really changed my view on how I'm looking at how I approach these things about indoor environments, because I realized that all those things work together and are interactive, and that really, this kind of all hazards approach might be the best way to solve these problems. And that's kind of stuck with me for the last more than 10 years.
Mm-hmm. Okay. All right. Well, David, I appreciate your presentation and the resources. I think I have an older version of this, but if you could send the latest, greatest, I'll upload it.
And then what I'll also do is I will send out, there is a webcast which has the about toxicity of disinfectants, and I will get that to you. And then I'll think about your broad problem statement, and I'll try to get that to you either tomorrow or Monday.
Perfect. I appreciate that. And so everybody, please thank David, on your way out today. And for many of you, I know, are dealing with Mother Nature's fury here. So stay safe, stay warm if you can. And
if I can interrupt, I want to thank you guys, because I've learned so much from listening to these conversations over the last 6 months. So I want to thank you all too.
Oh, absolutely. And next week, I'm really excited. One of our participants, my peer of mine in Colorado, Susan Miller, who facilitated the week I had to miss a few weeks back, has a family member who, Sarah Sutton, who's at Northwestern, and she's an infectious disease expert. And she has been, for the past several weeks, We've been prepping and discussing with her to take a broad view, the long view of infectious disease and response, what we've learned. She did a particularly deep dive in looking at HIV and its spread in responses to the HIV epidemic here several decades ago in the US, and just has a view, a long view that I think will be very helpful for us to ground where we're at right now and maybe help see past it even dimly. So please, if you're able to schedule next Thursday, we'll look forward to Sarah, Dr. Sutton's conversations. Again, thank you, David. Thank you, everybody on this call for your questions and comments, participation, and we'll keep it going next week. Stay safe and have a good evening. Thank you.